Hi, I'm Frank Spear. I want to welcome you to this blog. This is going to be our second part of our anterior temporary segment. What I'd like to do in this segment is talk to you about methods of fabrication. Certainly we can take a matrix and we can fabricate our anterior temporaries directly in the mouth, and it's not infrequent that I do that. But I really enjoy, in cases where aesthetics is really important, I enjoy making my anterior temporaries actually indirectly. Easy, very easy technique to teach your assistant. It can be done using stone models, or what I'm going to show you here is a very fast technique actually using a silicone model. Parkel produced a product years ago called Mach 2 dye silicone. They also have a newer version called Mach Slow that sets a little slower. And in this series, I'm just going to show you how to make a silicone model in about 3 minutes time for you to then make your anterior temporary on. And I'm going to actually do this on a deniform just as an example of what you may be doing in the patient's mouth. So in fact, we're going to make a model using the Mach 2 silicone and then bite registration paste as a base. This is what the silicone model is going to look like. We're going to then use it to actually make our temporary. And literally we'll just take a matrix. What I've done is make an alginate impression of the deniform, pour it in stone, and then pressure form a matrix out of a product called Copyplast. We'll make sure the Copyplast seats on the silicone model. We'll then inject our material, our temporary material, into the Copyplast, seat it. No need to lubricate the model because it's silicone, it's not going to stick. Once it's hard, we can lift it off, and then in future segments we'll go through how to trim it. And so here's a very simple way to do it. You simply mix up your alginate impression material, put it in a centric syringe or a monoject syringe, and now inject your alginate and then seat your tray over the top of it. And now you have an alginate impression of your preps. Typically I would always do that after the final impression so that I've gotten retraction so that I know I should capture the margins of my preps in the alginate. Then we're going to take our Mach 2, and as I said, Mach Slow is a little slower setting. Mach 2 you have to work pretty fast. We inject it so it fills up the alginate up to the gingival margins. We basically want the teeth filled up with Mach 2. And then using a bite registration paste, this is AccuFlow, over the top, and then inverting it and putting it on a little plastic slab. And you'll see why in a minute I like to do that. So there's the bottom of the plastic. You can see it's perfectly flat. And now we've got our model literally within 2 to 3 minutes time. And if there's any little blubbles that were in the alginate, you can pick them off. Now, why make the silicone model on a flat plate? Because when you seat your matrix, you want to be able to push on it. And if the silicone doesn't have a flat base, it can distort. So we make the silicone model on a flat base so we can literally put our matrix down and put pressure on it and not have the model distort. And here's how that would look. Trying in this case the Copyplast. I like to use clear Copyplast because I can see what I'm doing with it, whereas a silicone matrix I can't. I'm injecting ProTemp Garant into that matrix, load it up to about the gingival margin, and now go ahead and put that matrix onto the silicone model, and I can firmly set it down on the laboratory bench and push down on it now. It won't distort because it's got a flat base on it. Once the ProTemp or your temporary material of choice is hardened, you can now lift it off. Typically, again, since it's silicone, it doesn't lock on. Even though it's completely hardened, it doesn't lock on. And now you simply move your matrix, peel it away, and there's the temporary ready for trimming. And usually for me it would be done from a diagnostic wax up. As I said, this was done just directly from the deniform and alginated the deniform. But a very easy technique to make temporaries, because once you have a model to work with, you see everything better. You see the occlusal plane, you see the shape of the canines and the premolars. You can orient how the midline should be straight up and down relative to the posteriors, etc. And in future segments, we'll go through all of the steps getting it to this phase, which is this final temporary after it's been trimmed and stained and polished. So I hope you've enjoyed this segment. As I said, this is a technique that I've used for years. I use stone a lot when I'm not in a hurry. I'll actually take an impression, a second silicone impression, not an alginate, and pour stone in it. But if you want a fast anterior temporary technique that's very effective, using the Mach 2 model is one of those techniques. So I'll look forward to seeing you in the next segment when we're actually going to start trimming things.